So welcome to Healthcare Digest COVID-19 Episode 7, Revenue Cycle Considerations for Hospitals under the CARES Act. My name is Amanda MacBride, and I'm a Senior Consultant with Mazars USA in the Healthcare Consulting Group. And today we will also be speaking with Peter Avellino, who is a Director in the Healthcare Consulting Group. Today, some of the topics we're going to be covering are the CARES Act, adjustment of sequestration, DRG add-on, additional post-acute care flexibilities, the Medicaid DSH, expansion of the accelerated and advanced payment program, documenting COVID-19 cases, and then we'll touch on some of the resources that we used for today's presentation. So what is the CARES Act? The CARES Act, formerly known as the Coronavirus Aid, Relief, and Economic Security Act, was passed by Congress and signed into law on March 27, 2020. The CARES Act was put into place in order to provide emergency assistance and healthcare response for individuals, families, and businesses affected by the 2020 coronavirus pandemic. Throughout the presentation, we plan to cover some items from the CARES Act that hospital revenue cycles should take into consideration. And now I'd like to turn it over to Peter Avellino to talk a little bit about adjustment of sequestration.
Thank you, Amanda. Just to follow up on, or to add to one of the points that Amanda had made on the CARES Act, it's really an attempt to alleviate some of the financial strain on hospitals, physicians, and other healthcare providers through a series of Medicare policies that are designed to increase the Medicare Medicaid reimbursement that are allowed by with some form of added flexibility. So what we're going to speak about today are just some of the items, and there may be later podcasts or webcasts where we're speaking to some of the other items, and if there are any potential changes to some of what we're going to be speaking about today. So on the adjustment to sequestration, really what that is all about is that there's a 2% reduction in payments, if you will, to Medicare providers, which would include hospitals, physicians, home health services, and durable medical equipment companies. And the whole point behind it was a way in which to create some savings in order to protect the fiscal viability of the program in of itself. And of course, beneficiaries would not be responsible to pick up any of those shortfalls. What happens during the CARES Act is that the 2% is now suspended at least through the period of 5/1 to 12/31 as it stands today. Again, this is a way to provide some relief to the healthcare community, as I mentioned above. The next item is about DRG add-on. Amanda, if you can move the slide. So what this is, this act increases a hospital's inpatient prospective payment system, or IPPS payments, by 20% when they're treating COVID-19 patients. The act specifically speaks to the secretary having the ability or to increase the weighting factor that would apply to the diagnosis-related grouping, or DRG, for these COVID patients that are being discharged, now being assigned by as much as the 20%. This weighting factor is used by the secretary for the relative hospital resources used with respect to certain DRGs versus others. So it doesn't mean that all would be covered under this, but if it's a COVID-related patient, then in fact you would get that. To get more information, again, this is only during the emergency period, and if you're looking for more information, that would be under section 3710. Amanda. The next item is additional post-acute flexibilities, and what this really speaks to is the post-acute care or PAC providers that would be paid additional funds during this period. Also referenced in 3710 with respect to the emergency period. So one item in particular is the inpatient rehab facilities, or IRFs, are required to provide 3 hours of therapy during a normal situation. They're now being suspended during this emergency period. Long-term care hospitals, or LTACs, are also, in this setting, they will be paid at the IPPS rates versus the LTAC PPS rates. So there's going to be significant dollars more, even though these will be patients with a lower acuity. And then lastly, the LTACs are typically required to carry up to 50% of their patients to be paid at those lower PPS rates, and that is also suspended at this point in time. Amanda. The Medicaid dish issue, this is, at least as it stands right now, they're going to provide the $4 billion in elimination on dish cuts that was scheduled to take place in 20 has been eliminated altogether. And in 21, what they've done is they've reduced it drastically by $4 billion, at least as it stands right now. So there'll still be a $4 billion cut to the program in 21, but it would be roughly half of what was initially expected. And in this case, the implementation is going to take place sometime in 21. We don't know what other cuts are going to come and what other changes that will happen with respect to this, but as it stands right now, this is where they're at. Again, the fiscal 21 may change as time goes on, depending upon how long we are sitting in this epidemic. Amanda.
Okay, now I'm going to cover a little bit about the expansion of the Accelerated and Advanced Payment Program. So CMS has expanded their current Accelerated and Advanced Payment Program to a broader group of Medicare Part A and B suppliers in order to increase cash flow to providers of services and suppliers impacted by the coronavirus pandemic. And in certain circumstances, when a hospital is experiencing financial difficulty due to delays in receiving payment for Medicare services provided, it may be eligible for an accelerated or advanced payment pursuant to the Medicare Accelerated Payment Program. And in an attempt to get payments to hospitals more quickly, the Act revises the Medicare Accelerated Payment Program to do the following things. One is increase the prepayment amount from 70% to 100% of expected Medicare payments. Two is increase the length of time accelerated payments may cover from 3 to 6 months. 3 is delay the start of recoupment of any overpayments from 90 to 120 days. And 4 is extend the due date for any outstanding balances from 90 days to 1 year. This act also expands the Medicare Accelerated Payment Program for the duration of COVID-19 emergency period to children's hospitals, cancer hospitals, and critical access hospitals. And at the bottom of this slide, we've also attached the link on how to request your accelerated advanced payment. Next is documenting COVID-19 cases. With the release of the new ICD-10 codes for coronavirus, it's more important than ever for clinicians and coders to correctly document for these cases. Some key things that organizations should consider are keeping your terminology throughout your organization consistent. Earlier in the stages of COVID-19, the terminology was still evolving and the virus was referred to a couple of different things, but today it's consistently referred to as COVID-19. Another consideration is ensuring that clinicians keep their documentation really decisive. For example, terms such as probable, possible, and likely can change the coding of a COVID-19 case to a case of suspected or exposure. And missing that COVID-19 diagnosis can not only affect reimbursement, but it also affects data collection and reporting for the public. And then some additional items to consider are the extended hospital stays that some of these really critical COVID-19 patients could be having. These stays may be long, sometimes averaging around 18 days, but they don't involve as many services, which are leaving lower operating costs. And this could in turn cause hospitals to lose out on outlier payments based on those high cost stays. And then one of the main takeaways about documentation that we want everyone to keep in mind are that organizations need to consider that the guidance is continuing to evolve, and it's really important to keep updated on the issued guidances. And then a little bit more on additional specifics related to the COVID-19 codes, you can refer to our Healthcare Digest COVID-19 Episode 3, Billing Considerations with COVID-19.
Amanda, if you could just go back to that previous slide for a moment. I would just add one point here that I think is worth mentioning as it relates to outliers. Outliers could potentially be another opportunity for hospitals, especially during COVID. But one of the concerns with the outliers is that although they potentially could be eligible for it, most patients are going to be in a management setting. And we're seeing average length of stay somewhere between as little as 6 or 7 to as much as 20 and more, depending upon what marketplace you're in. So some of those larger stays with an average length of stay of 18 plus days could potentially trigger an outlier. But the other factor that will come into play and why the documentation is so important is that when we're dealing with costs like ventilators, not indicating or not being able to show what was performed on a particular day will prevent them from triggering those outliers. So it's absolutely critical that all of the information, all the charges that have been entered for a particular patient, as well as the documentation that sits behind it, is there to support it, are done on a timely basis. If not, not only are other fees that are potentially up for some type of take back, but you could even lose the potential opportunity for an outlier that would add additional dollars to a particular claim. Thank you.
And last, here's some resources that we use to help put this presentation together. And we just want to emphasize the fact that the guidance is continuing to evolve and to always just stay updated on the issued guidance. Right, so for any additional information on the topic we covered today, you can visit some of these references that we use to put together our presentation, and keeping in mind that these references are ever evolving, so continuing to review them is important.
Thank you all for taking the time to visit us today. For additional information, please feel free to visit our website at mazarsusa.com/HC or mazarsusa.com/COVID19. Again, my name is Peter Avellino, Director in the Healthcare Group, and Amanda MacBride, who also presented today. She's a Senior Consultant in our Healthcare Group. Please feel free to reach out to either one of us if you have any additional questions on the subject matter discussed today. And lastly, we want to thank all the healthcare workers for the tremendous work that they are doing in this very, very difficult time. We look forward to our future episodes to discuss this further. Thank you.